An indoor cannabis. 27-year-old female began working at an indoor cannabis cultivation and processing facility in May 2021. She worked throughout the facility as a cycle counter, including in areas where the cannabis product was ground. In late July, she experienced nausea, loss of taste and smell, earache, and cough, and she had 2 negative COVID-19 tests. Bilateral diffuse wheezing was noted when a physical exam was performed during the evaluation for the second COVID-19 test. The patient's mother later reported that although her daughter had no previous history of asthma, allergies, or skin rash, she had developed work-related runny nose, cough, and shortness of breath after 3 to 4 months of employment. On October 1st, the employee moved to flower production, which entailed grinding of cannabis flowers for approximately 15 minutes, 3 times per day, and preparing cannabis cigarettes, also known as pre-rolls. These activities resulted in increased dust exposure. Dust from the grinder was collected by a shop vacuum. However, the vacuum had no HEPA filter and visible dust escaped. Other coworkers reported that the employee's cough increased, particularly when the grinder was on. Efforts to reduce her exposure included covering the grinder vacuum with plastic and moving her workstation outside the grinder room. She also used her own N95 respirator and wore company-required long sleeves and gloves while working. On November 9th, the employee had trouble breathing at work and was transported by EMS to a local emergency department. En route to the hospital, she received an albuterol nebulizer and her dyspnea resolved. She reported that she did not have asthma, but stated that she might be allergic to something at work because she had a cough and runny nose for more than a month. Bilateral faint wheezes were noted, and she was prescribed a 5-day course of prednisone, cetirizine, and an albuterol inhaler. Follow-up with a primary care physician was recommended. Her mother reported that the employee did not become short of breath at home except when carrying a heavy load upstairs. On January 4th, 2022, the employee told a coworker that her shortness of breath had been getting progressively worse during the preceding 2 weeks. Later that day, while filling pre-rolls, she began sneezing and her coughing increased. Despite repeated albuterol inhaler use, her difficulty breathing worsened and EMS was called again. She suffered a cardiopulmonary arrest before EMS arrived and her coworkers began resuscitation. She regained spontaneous circulation, but she did not regain consciousness. Expiratory wheezing was noted. Anoxic brain death was diagnosed on January 7th, 2022, and care was withdrawn.